Hi, welcome to Suman TV viewers. I am Dr. Chava Anjaneyulu, Senior Consultant ENT Surgeon and Chairman for Asian ENT Care Center located in Panjagutta, Hyderabad. I have all types of lasers and specialized in laser surgeries. These laser surgeries help to cure many diseases of the nose, throat and ear. Nasal obstruction or mukku dibbada. This nasal obstruction mainly due to the anatomical abnormalities in the nose and the hypertrophy of the mucosal structures, sometimes extra growths like polyps, any other tumors. In children, the nasal obstruction mainly due to the adenoid hypertrophy. So in ages, if you see the ages, different ages in the common pathology is different. If you see in less than 10 years age, the commonest problem is adenoid hypertrophy and inferior turbinate hypertrophy. If you go into middle age between 15 years to 30, 35, 40 years, the common problem is deviated nasal septum, inferior turbinate hypertrophy. If they have any allergy problem, polyps is the another more important reason. After 40 years, the common problems are turbinate hypertrophy, nasal polyps, mainly sometimes tumors also. Especially patient is having nasal obstruction with bleeding from the nose, never neglect. Because in children this is due to foreign body impacted in the nasal cavity, that we call it as a rhinolith. This rhinolith causes nasal obstruction, nasal discharge, foul smelling, sometimes blood. In young people, especially male people, if they have nasal obstruction with bleeding, you always suspect angiofibroma and do the nasal endoscopic examination thoroughly and check for the pathology. In old age, always there is a chance that nasal malignancy, nasal tumors, nasopharyngeal carcinomas, all these are the causes of the nasal obstruction and blood from the nose. So never neglect nasal obstruction. Now coming to the common nasal obstruction problems in children, the common problem is adenoid hypertrophy. In these days, these children are not getting adenoid hypertrophy relief with medicines because of the persistent pollution in different ways around the children and more viral infections. There are continuous viral infections coming, new viruses are coming. So, continuous viral infections and pollution causing persistent inflammation of the adenoid and adenoid hypertrophy. So, adenoid hypertrophy usually we treat with the adenoidectomy with the coabulator. It is very safe procedure. Many parents, they think if we remove adenoid, there is a chance of less immunity. There is nothing like that. If you remove the adenoid, no problem regarding immunity. But persistent adenoids cause the problem to the children. So whenever patient is suffering with adenoids, remove that adenoid. In adults, the common reason is the inferior turbinate hypertrophy. Inferior turbinate hypertrophy mainly due to the stress, pollution in the surroundings, and viral infections. Viral infections, pollution, stress, all these cause the inferior turbinate hypertrophy. Inferior turbinate hypertrophy is very simple to treat. We can do that with laser and coabulator. We reduce the size of the inferior turbinate. Patient will get immediate relief and persistent relief. If some patients get back that inferior turbinate, we can repeat it also. There is no problem. And it is completely safe procedure. Usually once or twice reductions will help the patient to permanent relief from the nasal obstruction. If you have any inferior turbinate hypertrophy, nasal obstruction problem, nasal allergy problem, snoring problem, voice problems, hearing problems, contact Asian ENT Care Center located in Panjagutta, Hyderabad. For further updates, subscribe Suman TV.